Good morning. Thank you for joining us for our second week of Avian Home Adventures. Today we're going to take you inside of our Raptor Hospital and you are going to see a physical therapy session with one of our barred owl patients. So we'll go over here.
Hi everybody, my name is Dave Scott. I'm the staff veterinarian here at the Raptor Center. It's a pleasure to meet with you this morning. So we have one of our barred owl patients, number 23175. This bird has been with us for 15 days. She came in with a fractured ulnar radius, so those are the two bones in your forearm basically. We assume hit by car, but we don't really know for sure. So she had surgery about 13 or 14 days ago, and since then she's been getting physical therapy to make sure she doesn't get stiff. So actually, if you want to take a peek at our friend here quickly, this is our friend. We keep their head covered because these guys are they can become very stressed the more they see. They're very visual animals, and so if we can keep them covered up, they're quiet and they relax and we can get our work done. So if you want to look at this screen over here, so this is a close-up view of our friend's forearm. So you can see this larger bone is the ulna. This the thinner bone is the radius. And those bones obviously are fractured, causes a lot of soft tissue damage as well, because you can imagine when both bones are fractured, the wing is literally just flopping around. Doesn't feel good, I'm sure. So we try to repair them with a series of stainless steel implants. Now this bird's case was different. What we typically do, I have an example here. This is a typical fixation, a skeleton from a past patient that obviously wasn't released for other reasons. So here's the radius bone. Here's the ulna bone, and we have a pin going into the radius. We have a pin going into the ulna. Then we have these two cross pins, and it's all tied together, and this plastic stuff would be external to the body. This is called an external skeletal intramedullary pin tie-in fixation. It's a mouthful, but that's what we typically do, and it works really well. However, in this bird, I wasn't able to do this full fixation. Her bones were actually very, very small, and this large intramedullary pin that normally goes into the ulna, I wasn't able to place that one in this case. So instead of that, she has an IM pin in the radius, this thin one. She has what's called a shuttle pin inside her ulna, which is a piece of polypropylene plastic. It doesn't show up on an x-ray, but it's actually aligning those ulna bone ends really nicely. And then she has everything bent around, and we have this sidebar kind of the same way. So it's a similar repair, but not exactly the same. So as we've been speaking, she is behind us on the table getting anesthetized, and we're using a gas called isoflurane, very safe, and we use it all the time, many times a day. And so we want her to be asleep because this is a painful procedure. We don't want her to be stressed or struggling, and we don't want it to be painful. She's in a wrap, which we're going to be removing. And then we're going to go through what we call passive range of motion exercise, where we literally just run her arm, the joints, through all the different angles that she would need to survive. So we're going to switch sides here. I'm going to take those feet. We never ever leave these feet unattended. This is a very, very dangerous part of the bird. And I'm going to come around on this side. Will the light mess things up?
Nope, you're good.
Okay, so I'm going to take this bandage off. Now, if I had been able to do that full fixation with all those implants that I mentioned before, she wouldn't need to be in this bandage. But the fixation that I was able to do, while it's going to work, it doesn't stand alone, and it needs an additional support, and that's why we have this wrap on here. So we're going to remove that wrap. And if you look on the back, you can see what I was talking about. Here's that plastic sidebar. There's an IM pin going down into the radius there. And there's a cross pin right here. And so that holds this all together. And now, I'm going to grab a piece of gauze. Hold on one second. These are closed. So she's asleep now. She may struggle just a smidge, and if that happens, we'll have to go a little bit deeper with the anesthesia. But anesthesia is something that you go up and down with as needed. Oh, yep, so she just reacted there a little bit. She has been generally somewhat painful on this when we've done physical therapy in the past, and we're only 2 weeks out, so that's to be expected. So we're just going to wait until she's a little, let's go up to like 3.5. So that dial over there indicates how much gas she's getting. And so it goes from 1 to 5, and we generally do this between around 3. But we're going a little bit higher with her because she needs it.
We have a question about
Yeah.
Owls are built for silent flight. Will this
Whoa.
wing fracture affect her ability to fly silently?
That's a really, really good question. So yeah, with a typical hawk, we don't have to worry about their sound level as well, but with owls, we definitely do. The sound level is generally determined by their feather condition, and they have a lot of different feather changes in the owl compared to the hawk that make that silent flight possible. In fact, this little edge right here, that little serrated edge, helps break up the sound coming over the front of the wing and reduces turbulence and reduces the sound level. So there's a lot of factors, but yes, if we weren't able to repair this wing well and she was flying awkwardly or tilted or something, that could easily affect her sound level. So in general, a fracture doesn't, but if she doesn't return to normal flight, then it certainly could. So you can see that she's got some minor feather damage here. She's missing a few of her what we call secondary feathers. Those hopefully will grow back. You can see there's a gap here. They're not all nicely lined up, but that will change in time once she's able to preen her feathers and realign these little teeny barbs and barbules, and those feathers will start to look pretty normal. We haven't addressed that problem yet simply because we're trying to get her fracture to heal first, and there we go. Now we're able, so she's relaxing more. Whoa, she reacted pretty strongly to that. So once she feels some pain, I just fold up her wing against her body and let her relax. We can go a little bit deeper. That'll take the edge off a little bit more. And so here, elbow is right here under my thumb, and her wrist is right here under my index finger. So we want a minimum of 140 or more degrees at the elbow. Yeah, that's the way that. And then we want 180 degrees at the wrist. So we want her wrist to be fully in a straight line. Yeah, and Matthias is showing you our goniometer. Sometimes I just call it our measuring thingy because that's easier. And so if we put the pivot point right at her elbow, you can see that she's, we're like, we can push it a little bit further. Yeah, I think we're definitely there. We're easily at 140 there. In fact, we're probably beyond, and her wrist is perfectly straight now. So this is great. Her physical therapy is going really well.
We have a question. How often do they get physical therapy?
It's another great question. So it depends on every case and every bird. I'm going to start weaning her down a little bit. We generally do Monday, Wednesday, Friday for the first week. Sometimes, usually the second week, and then we take it up or down as needed. In this case, we got a bird acutely injured. There wasn't a lot of scarring. It wasn't a chronic injury, and so her physical therapy is going really well, and we're going to be able to start tapering her off now. We have another bird that we actually just did physical therapy on literally 10 minutes ago. Her injury was very old and chronic, and we're doing her 3 or 4 times a week, and we're in her 3rd or 4th week now. So that bird's going to continue for quite some time. So it really does depend on the case. I'm going to get we can probably just go to this now. Well, no, I want to keep that on there. Well, I'm going to rewrap her wing. Again, because we don't have all those implants in an ideal repair, we're going to have to replace this wrap to help supplement the fixation.
Does the pin look good?
Yeah, that pin's a little dirty, so we're going to clean that up.
We have a question. How will you know when the bones are fixed?
These are really, really good questions. So it's 2 factors. How does it feel in my hands? Can I feel what's called a callus, which is like a bony lump over the fracture? And how does it look on an x-ray? So we will take x-rays every 10 to 14 days, and we'll be able to gauge really well when these bones are healing. She had an x-ray last Friday, and it showed that her bones were really well aligned, but there was no callus formation yet. And, that's only 10 days post-op, so we wouldn't expect that. But on her next x-ray, next week, we should expect to see quite a bit of callus formation, and then we'll start feeling better about taking her out of the wrap. Generally, we can remove our implants at about 5 weeks, but again, that varies depending on every case, but that's a good rule of thumb for an adult bird. So I'm going to place this figure 8 wrap back on her wing.
So next Monday, We will show you kind of the next step of rehabilitation for a bird that's had a wing injury. We're going to take you inside of a flight cage so that you can see how they start to rebuild the musculature that they lost while they were in these wraps and healing.
And cardio. They get pretty out of shape.
Yes. As we all know, with social distancing and with quarantine, we're getting out of shape.
So that's a figure 8 wrap. This is just vet wrap material, and it helps keep this wing in a nice, comfortable position. And then I'm going to back that up again with a Velcro wrap, and this is something that one of our volunteers made for us. And these are reusable, and they protect the vet wrap underneath, because owls can sometimes chew quite a bit on their wraps, and they can cause some damage to them. So I'm going to take this old duct tape off.
We have a question. How much does it cost to rehabilitate one of these animals?
Wow. Okay, so we don't really have a great way of gauging that, of course, because a lot of what happens here is donation and volunteer labor from tons of volunteers. But what I can tell you is if we were to estimate what the similar treatment would cost at a local avian vet, if this were a parrot with a paying customer client, this repair, the surgery, all the post-op care would probably run about $3,500. So it's not cheap. It takes a lot of work to get these guys back into the wild. And it takes a lot of support from the public to make this happen. That Velcro wrap's back in place. She's just running on oxygen now, so she's going to start to wake up pretty soon. And that's how it works.
All right. Well, as you can see at the bottom of this video, there is a donate button. So if you would like to help our avian friends with rehab and getting their food and medicine,
This is for $23,175.
Which means what?
That's our 23,175th bird to come through here. And Matthias here, I always like to embarrass him, has been here since day one. He's seen bird 1, and he's seen everything in between. Pretty amazing.
All right. Thank you guys so much.
Thank you.
For those that didn't get their questions asked, or you're watching this later and you have questions, please feel free to put them in the comments and we will answer them. Thank you so much.